Liquid biopsy is a big, field in some ways. It depends on the clinical applications because liquid biopsy can be used for early detection that we just discussed. It can be used for monitoring individuals or even selecting therapy or determining, let's say, after surgery if there are still residual disease in the individuals. So it depends on, the clinical application, and in some of cases, like, as I said, standard of care screening, we don't have for many different tumor types. So if it works, that will be a great thing. I don't see it, although, as replacing pathology, and I think it's an information, it's an additional information in the armamentarium of the physician that needs to treat, and manage the patients. I don't think any of those tests, either is liquid biopsy or pathology, stand on its own. I think we learn, and we actually, trying to integrate all this information, the clinical information of the patient. So there's going to be a combination. I think it's a great tool to provide information that adds to the information that we have from other clinical aspects.